We do have a table up here. I'm going to ask the presenters to come here, and I think now is appropriate time to take questions. So if we can all go up there, and there may be some questions. I do realize that we're blocking lunch for you.
Yes.
But maybe if there are some questions, at least because we did say that we'd open up to questions afterwards. And thank you very much. So as they collect, are there any questions from all the presentations that we had in relation to Candrive today? Again, I think that it is a summary of, yes, there's a question back there, and I think this will
clarify the cognitive assessment. You listed a whole battery of them. Are they all done in the same subjects over longitudinally?
So for the cognitive assessment, for each year, so when you enrolled, it was a 5-year prospective cohort study, is done in-house testing. The cognitive battery is published. It does, and you saw a number of the measures there used. The assessment itself had physical, cognitive, and behavioral measures within it. Had simple paper and pencil tasks. At some sites, there were other tasks that were unique. We did do sub-studies at some certain sites, but most of them were paper-derived. So the mini mental status examination, the Montreal Cognitive Assessment Test, Trails B test, the motor visual perceptual test, other types of tests are carried out in that manner. Yes, Lisa.
So I think a lot of people have talked about the need to really follow people for a long period of time. Thank you. So we've talked a lot about the need to follow older drivers over a long period of time, particularly given that many people who come into the study are relatively healthy and high functioning. So did you, and you did find significant differences between year 1 and 5, did you look at partial data in years 3 and 4 to see if there were any changes, or did you just assume you needed to wait that long?
So I think Lisa raises a very good question. So I showed you the people who remained in the study, and I think some of the more interesting, and it was one slide highlighted, the persons who withdrew from the study, and often I think that even just talking to research associates, and we can talk to the other investigators, often were leaving due to health challenges. We haven't presented that data today, but I'm preliminary looking at it. I think that data speaks to a different population, the ones who are dropping out, because that's the irony in a way. It's the ones who are dropping out in your longitudinal study who might have the more interesting in data in the long run, and those who are kind of ongoing tend to be generally healthy. So there are changes. Do others have comments on that from what you've seen?
Okay. Yeah, I guess in the preliminary analysis for the first 3 years of the driving data, Shawn, we did see some of those health dropouts popping out as being different in their driving patterns and driving in a way that you'd probably predict, driving less at night, self-regulating more.
That was one of the challenges of the study, is that also their ability to endure the 3-hour assessments, the need to be followed up. Sometimes you're losing, one of the challenges, you're losing the exact people who you'd really like to follow further. And that's one of the challenges of a voluntary type study. So that was beyond our control. We do have their data, and we will be looking at that to see those trends. I think so we'll have to analyze further. I think that's a good question. Yes? Okay. Yeah.
How much can you reveal about where you decide or how you decide what level of stratification, what that means? Is there a bar drawn somewhere? You either make it over the bar or you don't jump high enough? Or?
Good question. So they're referring to the brief teaser of a slide I showed about the risk stratification tool. So when we initially started off the Candrive, Ozcandrive study, we were all looking at a driving decision rule as a way to go, kind of a cut line. At the time we're thinking, are you safe, are you not safe? Kind of over time, and as the decade progresses, I think, and now in Canada, and I presume probably in the United States, a lot of research and a lot of emphasis is going to patient consumer empowerment. And really it's getting down to kind of making decisions and allowing that. So a risk stratification tool will tells you your relative risk, or kind of your risk for driving collision or your driving health compared to others, to make decisions about going that way, about what to do about driving. For instance, should you prepare to stop driving? Should you, in fact, stop driving right now, or are you in a safe zone? So this is kind of the way we're kind of envisioning that. We could come up with a cut line saying your risk is this high, but we felt that this is the model that goes. And it seems to work well because the same thing happens in healthcare, because decisions aren't absolute. In fact, what is one of the biggest challenges of trying to say who's unsafe to drive is you're trying to predict something that may never occur, and in fact, if you stop doing it, it won't occur. So it's a strategy on trying to have people adapt to make changes in their life given the information they have based on the evidence. So that's the approach we're taking. I don't know if other people have comments about that or. Yes, question? For sure. Absolutely.
Yes, great. Just wondered if, when you talked about decrease in mileage, mileage and trips, if you considered change in work status. So just wondered, at age 70, that might be a time there would be a change in work status.
We haven't looked at it in the modelling yet, but we could do that. We have some information about their health status on an annual, their employment status on an annual basis. These were all recruited at age 75 years and older at the start, so they were very, very small numbers. I don't remember the numbers off the top of my head, Sjaan may. Very small numbers who were fully employed, quite a number who were part-time employed, and quite a number who were volunteers in the community. So these things may have changed, and it may well predict, and that's a good point. It needs to be in the model at some point in the future.
Great. Well, what I'd like to do is thank everyone for presenting for the Candrive, Ozcandrive data today. I think clearly more information is coming out of this. We're at the exciting stage where we're concluded, but have lots of data to analyze, and hopefully that was helpful today. And I'd like to thank the presenters, and thank you for inviting us. Have a good day.